is now inside Oregon prisons. But how do you stay socially distant when you're behind bars?
Because if you go through a coughing fit, our bunks are so close, it's impossible not to cough on somebody.
Judging from one inmate's account, you don't. And for people who were trapped overseas because of coronavirus, getting home was only half the challenge.
We were quarantined for 14 days.
And judging from our inbox, apparently we didn't do a good enough job explaining why Oregon's gas prices are so much higher than the rest of the country's right now. So, how about a do-over? Here's the story. And welcome to the story. It is my wedding anniversary this weekend. Restaurants and shops are closed, and I'm not nearly creative or romantic enough to cope. I'm Dan Haggerty. Thanks for being with us. As always, send your questions, concerns, thoughts, gift ideas for my wife during a pandemic, critiques, anything at all. Find us on Facebook, Instagram, and Twitter. Use the hashtag #HeyDan. We're checking it throughout the show. We read some of them at the end. Let's talk. Meanwhile, I want to begin by checking in on some of the Oregonians who have been unable to socially isolate as easy as the rest of us because, well, frankly, they've been stuck out of the country trying to get home. We've profiled a couple of them for you. We heard back today from 19-year-old Amelia Wang, who was starting her first day working at a school in Honduras when she got word the country was shutting down and she had to stay inside. Her family managed to get her on a flight back to PDX last week. But even then, it wasn't over because when she landed, she couldn't even hug her mom and dad. Amelia has to stay quarantined in a room in her parents' house for a few more days before they can have any contact. In the meantime, we also heard back from Sandy Cahill. She was stuck in Morocco with 9 of her friends. We chatted about her trip back home to the States a little earlier today.
So we had to fill out a piece of paper on the flight that asked about shortness of breath, fever, and coughing, general health, what countries we had visited in the last 2 weeks. And then we handed that form in. And as I said, 10 people at a time deboarded. And we got interviewed by a CDC person who asked us the same questions, had a little chat with us, and then gave us the instruction that we were quarantined for 14 days.
And that 14-day quarantine for her ended today. Now, the State Department said last week that more than 50,000 Americans abroad have been asking for help to get back home here to the United States. Sandy had some advice for them, people who are stuck there, something she said helped her get home. Go to the airport every single day and wait and watch for any flight to get you out. All right, let's talk now about our big story tonight, which is actually kind of a follow-up on last night's big story. It's about keeping this pandemic out of Oregon's prisons, and that is proving to be very difficult. Now, last night we told you about an employee at the Oregon State Penitentiary in Salem who had tested positive for COVID-19. Officials across the criminal justice system, they all fear this virus spreading further within Oregon's prisons and jails, and it turns out those fears, well, they were warranted. 24 hours later now, 2 Marion County jail workers and an inmate at the Santiam Correctional Institution have also tested positive. Now, last night, Governor Brown told Maggie Vespa she is considering using her clemency powers to release some inmates early and bring down the population inside these prisons. That would help everybody kind of space out a little bit more and keep their social distance. But tonight, we're hearing from someone new. An inmate in one of those prisons called Maggie to describe what life is like right now inside.
Did you mention at the beginning of that, you said that you had a cough?
His name is Skylar Floro. He's 23 years old, and he called from the Columbia River Correctional Facility, a minimum security men's prison in Northeast Portland. He's there serving a 5-year sentence for 2 counts of robbery. Floro says he and other inmates have been watching the news, and they're scared about this pandemic like everyone else. He is especially scared.
I have no fever, but I've had a bad cough for like a week and a half, and like shortness of breath and chest pain.
Floro told me he was checked out by medical staff who told him his oxygen levels were fine. He felt good about that, but he had a request.
I asked medical for a mask so I would not cough on other inmates because we are forced to live in conditions where we are only a couple feet apart. Because if you go through a coughing fit, our bunks are so close, it's impossible not to cough on somebody. I can lay out my hand and
KGW verified Floro's name, record, and prisoner ID number through the state system. We also took his complaints to the Department of Corrections, who told us one of his concerns is being addressed next week. Masks are coming to Oregon's prisons. These are photos of them. 30,000 total are being produced by inmates in Eastern Oregon for prisons across the state. Each inmate will get 2. Each employee will get 1. That said, another big concern is tougher to solve. Last night, the Department of Corrections chief medical officer told me maintaining social distance inside Oregon's prisons, which contain more than 14,500 inmates, is not always possible.
People have to go get their medications 3 times a day. They have to go to chow 3 times a day, which is to eat their meal 3 times a day.
As a result, advocacy groups are calling on Governor Kate Brown to use her clemency powers to bring the prison populations down by releasing elderly inmates, the immunocompromised, people with release dates already set for this year or next, and people whom DOC staff believe can safely return to society. Today, the American Civil Liberties Union of Oregon joined that call.
Not taking steps to protect people in custody from a life-threatening illness amounts to cruel and unusual punishment.
The governor says she's considering it. Meanwhile, we've learned local jails aren't waiting. Tonight, the Multnomah County Sheriff's Office tells KGW they've reduced their jail population by 30%, taking into account each inmate's health, charges, what's left of their sentences, and other factors. Abby Stamp heads up the local Public Safety Coordinating Council, a government agency that serves as a bridge between city and county criminal justice systems. She said law enforcement, judges, defense attorneys, and prosecutors are working together to figure out whom they can safely release.
When the decisions are made together where the law enforcement, DA, defense, every single partner agrees, that's a space where we feel like those are safe decisions. Those are the safest decisions we can come to.
Okay, Maggie Vespa joining us live now. Maggie, obviously prisons and jails aren't designed to be spacious, right? So we could see this problem getting out of control. Multnomah County not the only one pulling back at this point, right?
Yeah, exactly. And again, just since our story last night, we want to point out we have an image of it. Clark County Sheriff's Office posting on their Facebook, letting people that know that they've gotten their questions because people had heard that inmates have been released. And they confirmed, yes, they've released 200 inmates from their jail. The sheriff in Clark County writing they worked with judges and a prosecutor to make that call, including and released inmates who were, they said, medically vulnerable, those who were awaiting trial but hadn't yet been convicted, among other groups. And then the sheriff added, quote, "But in a nutshell, if you are a violent felon, sex offender serving a sentence for a sexual crime, or if you have an in-custody sanction or sanctions that would deem you a high risk, you will not be released." So again, a similarly kind of complicated and multifaceted decision-making process like what we've been seeing in Multnomah County. And obviously, if Governor Brown were to use her clemency powers and do this with state prisons, that brings in another layer of government, another layer of decision makers. So it kind of gets more complicated, but advocates say there's no time to waste. They point out there are staff walking into and out of these prisons every day where everybody's really confined together, and then those staff go and live among the rest of us. So their point is an outbreak in a prison would not stay in a prison. Dan?
It makes a lot of sense. Maggie, thank you so much. Appreciate it. Maggie shows you the masks that were being sent into Oregon prisons right here. Look, the CDC is now recommending that people wear cloth masks in public. President Trump just announced that a few hours ago, but it is still voluntary. In fact, practically in the same breath, so to speak, President Trump said that he, in fact, is not planning on wearing one himself. But you can see right here, this is a picture of Washington Governor Jay Inslee started wearing a mask today. And like the one he's got on, the CDC wants you to use non-medical cloth. Do not use a medical grade or surgical mask, and we've been telling you about why for a long time. It's because they are in really short supply right now, and medical professionals need as many as they can get. So what can you use? Well, a lot of people have already started using things like bandanas and scarves to cover their face. But despite all this, health officials here in Oregon want you to know that while masks can control the spread, especially if you are carrying the virus, it cannot replace staying at home. And that brings us to our quote of the day from the Oregon Health Authority. They say, above all, we continue to stress that the reliable tool we have right now to prevent the spread of COVID-19 is strict social distancing. So even if you're one of those people who decide, look, I'm going to wear a mask when I go out, this doesn't mean that everyone is now suddenly safe and we can go back to living our lives normally. Keep staying home. Keep yourself safe as you can be. Stay apart from other people. Nothing on that front should change. And as you're kind of sitting there hearing me say that, that and pondering if you should start wearing a mask everywhere you go now, I'll remind you how weird that is. How weird all of this is. Weird and stressful and lonely and scary and weird. And it's perfectly normal to want to vent about that. Today, we partnered with Lines for Life to answer some questions about mental health on a Reddit AMA. And for all the non-millennials out there, AMA stands for Ask Me Anything. It's a pretty well-known forum on Reddit. You ask a question, and an expert answers it, or whoever's hosting that forum. Now, in this case, the experts were Greg Borders and Dwight Holton from Lines for Life. They're a nonprofit focused on preventing suicide and substance abuse. Our assistant news director, John Tierney, also answered some questions with them, and I asked him how it went today.
What they've been telling people who call the Lifeline are kind of 3 big steps for everyone who's feeling some anxiety, is stuck at home, feels kind of off kilter. 1, create a routine in your life and try to stick to it as best you can. Whether you're working, set a routine and you're working from home, whether your family is isolated, whether you've been laid off and you're trying to find a way to fill your time now, create a routine to give yourself some sense of purpose in meeting. 2, move. Get some exercise, get outside, get some fresh air. If you can't get outside, do yoga, with a lesson on YouTube or something. Find a way to just move, get some exercise, stay active. And 3, stay connected.
So stay connected. Phone calls and FaceTime. There's this thing called Zoom. It's free. It has become this really great way for entire families to get together on video calls. If you don't know what that sort of thing is, there are a bunch of YouTube videos that show you how to use all of this stuff. So just look it up. But maybe you feel like you don't have anyone to talk to or no one to listen to you. Well, this is the phone number to Lines for Life. 24-hour lifeline. 800-273-TALK. Write it down. Put it in your phone. Look, these are really great, really genuine people, and they want to hear from you. When the story continues, we're going to take another shot at answering some questions about gas prices because it's come to our attention that we may not have been as clear as we should have been yesterday. And we're heading back into the KGW Vault. And it may feel like we've never experienced anything like this coronavirus outbreak before, but we have. And it actually looked a lot like it looks now, just without the trendy terms like social distancing.
Okay, it's time to answer some viewer questions. So Candace wants to know, hey Dan, have our Oregon leaders stated what criteria needs to be met before the stay home, stay safe orders are lifted? Is it no new cases for X number of days? Or will it be some sort of mass testing process to determine exactly who needs to be isolated and who does not? Thank you again, Candace, for that question. So we reached out to the governor's office for this. They said it would be premature to come up with any cutoff points right now or to come up with some sort of criteria. A spokesperson said we must all continue to stay the course until the public health threat to Oregonians has passed. So stay home, they said, and stay safe. Keep sending in those questions using the hashtag HeyDan. Okay, this viewer wants to know, hey Dan, I'm a healthy, almost 60-year-old. I have an upcoming doctor's appointment, a follow-up. Should I keep the appointment or cancel it? Thank you, Barb, for that question. So the doctors that we've been consulting with for all of these questions, they recommend postponing any non-urgent medical visits for 2 reasons. 1, doctors' offices attract sick people, and if you're well, you should stay away from sick people. And number 2, doctors are so stressed right now with the increased patient loads, and anything we can do to take pressure off the healthcare system is a good idea. It's also a good idea to keep sending in your questions using the hashtag HeyDan.
All right, Kristen, thank you. So last night, right here on the story, we talked about how gas prices are going down across the country, basically because fewer people are driving, and supply and demand, that's how that works. But prices are still pretty high in Oregon, as a lot of people have noticed. And some of you weren't really quite satisfied with our explanation as to why we usually have higher prices here than the rest of the country. Michael's sending in this Facebook message saying, hey, Dan, you just justified Oregon's high gas prices because we don't have refineries. Numerous states around the country have no refining capabilities. Nice try. Why is Oregon's prices 30% more than the national average? Love your show. Well, isn't funny all I heard there was a compliment? All right, look, you're right, though. We didn't really get into all of that last night, so let's do it tonight. We reached out to AAA, and here is what they told us. Yes, part of it is that we don't have refineries in Oregon, but really the entire West Coast is also just geographically isolated from where a lot of drilling happens. We also have environmental policies and programs that bump up the cost a bit. And even though there's no sales tax here in Oregon, we do have a state gas tax of 36 cents a gallon, which is pretty pretty high, on top of the federal tax. So there's just a lot of taxes, guys. And at Portland, for instance, other cities like Portland, they add an additional tax on top of it. Also, contrary to what you might think here, Oregon's ban on self-serve gas doesn't really contribute to higher prices. Gas stations in other states, they have a tendency to, they just do other things instead of pump gas. So hopefully that sufficed tonight. All right, the KGW Vault is full of old pictures and news clippings of the last time a pandemic shut the planet down in 1918. And we've done a bunch of stories on the Spanish flu so far already. But Nina Melhoff dug a little deeper into the vault and learned how Portland tried to stay open while the rest of the world shut down.
In 1918, World War I was raging on, and reports from the battlefield came in that a strong respiratory illness was taking out soldiers. The Spanish flu infected 1 in every 4 people on the planet within the next year, killing at least 50 million people. But just like in 2020, officials in the U.S. and, yes, Portland back then were kind of slow to react. Northwest historian and podcaster Doug Kenck-Crispin has been studying the response.
It's very similar to a lot of things that you might have heard of from Portland Mayor George Baker, who was the mayor of Portland during the time of the influenza of 1918. He didn't really want to shut Portland down. And he was told to by the U.S. Surgeon General and public health officials. He was told, now you need to close this place up. And he said, you know, what about the economic impact that's going to have on the city?
Eventually, there were mandates to get the heck away from each other without the trendy hashtag of social distancing. Look at old headlines from the Beaverton Times in 1918, where it wrote of many things shut down and closed.
And it's really kind of a loose close. You know, stores were open until 3:30 p.m. People were still taking mass transit and so on. You know, but the schools were out. You couldn't go to church. You know, you couldn't have large public gatherings and that sort of thing. So that went on for 6 weeks.
People became more paranoid. Cartoons like this one from the East Oregonian showed a baby tipping over a pepper mill and everyone sneezing, calling the doctor thinking they've all got it. The similarities are seriously weird. People across the country and these Red Cross nurses in Boston sewed face masks out of cloth. In New York, mail carriers wore them. The Spanish flu would make you cough up blood, filling lungs till they quite literally drowned. Babies and young people got it just as bad. Soon, hospitals became overwhelmed, and just like we're seeing today, makeshift wards sprang up in warehouses, auditoriums, and fields. Benson High School in Northeast Portland was a cadet training facility, and it's where the outbreak here in the Rose City started. Oregon movie theaters, though, stayed open, but slates before the films read "Smother the sneeze to prevent disease." Soldiers and sailors were banned as they were early carriers of this flu. And God forbid you sneeze or cough for any reason, the old-timey cane would come out and you were 86th.
November 11th, 1918, the war ended. The closure at that point had been about 6 weeks long, and Mayor Baker wanted to allow Portlanders to have a huge festive party and to kind of get life back to normal. And so he allowed the closure to end just 5 days later. And so what happened is all these people that had been pent up and all these people that had had their lives modified rushed out into the streets.
A few weeks later, and flu cases and deaths started spiking again before they could get it under control. It is a century-old lesson. We cannot rush back to normalcy.
Wow, super interesting story there, especially with the old pictures like that. And her final line of that, we cannot rush back to normalcy, is something that we all need to keep in mind, I think, as this goes on and people get anxious and eager to get back to normalcy. It's going to be a while. Now, you've heard a lot about the modeling of the coronavirus. So I want to talk a little bit about how that's done, how scientists and epidemiologists model a virus. It takes a lot of math, but I'm going to break it down to a couple of simple terms for you. And one is, there's three basic terms here with the really basic modeling of a virus. It's called the SIR model. The S stands for susceptibles. That's basically everybody when a virus begins like this. Everybody on the planet was at one time, or still is, a susceptible. Then you have the I, those are the infectives. Those are the people that have the disease and can therefore spread it. And then the last group, R, is those who have been removed from being susceptible. Either they got sick and got over it, or unfortunately they perished because of the disease. Now I'm going to show you a picture here of some food delivery workers waiting in isolation, which is absolutely key, because if you're susceptible, as we all are, but you're in self-isolation, you remove yourself from that pool of the susceptible. So that's why self-isolation is so important. On the other hand, if you are sick and you're an infective, but you stay home, then you immediately go into the removed population because you are not spreading the disease. Those are two key points when it comes to modeling. They look at something called the reproductive number. That has to do with the reproduction of the virus itself. If it's greater than 1, it's spread. If it's 2, it takes 10 steps to get to 1,000 people, and 10 more steps, 2 people will have spread it to 1,000,000 people in like 20 steps. It's exponential growth, which is what we're seeing in this next graphic, and which is how it happened in much of the world. But you see on the curve here in the UK how it was pretty flat, and then in March it just spiked up incredibly. So that's one way that epidemiologists model a virus, is by breaking the population down into those 3 pools using some fairly simple equations at first. I know they get more involved, and this is just one model, but it is interesting to look at that, and there are key steps, key takeaways here. Remove yourself from the susceptible population by self-isolation, and if you're sick, definitely stay home. Dan, back to you.
Yeah, thanks, Matt. If anybody has any doubt about that, just look up those charts on exponential growth. It really is amazing what one person who is infected can do with a virus like this. Matt, thanks again. Hey, let's talk about sports right now. Yeah, I know there are no sports right now, but that doesn't mean we can't talk about things like this. Oregon Ducks basketball superstar Sabrina Ionescu just won her 5th National Player of the Year award, and that's on top of a bunch of other awards and honors that she's gotten recently. You might remember before the season got canceled, she became the only college basketball player, male or female, to get 2,000 points, 1,000 assists, and 1,000 rebounds in her career. It's really, I don't need to say this really, but it is such a shame that she wasn't able to finish out the season, because she's honestly one of the best of all time, and we got to see her play right here at home. As our Orlando Sanchez put it, if there was a Mount Rushmore of Oregon college athletes, she'd be on it.
Over and over again, we were able to witness just one of the legends of the game, and now there's still so much more ahead for her as she heads into her professional career and will be the #1 pick in the WNBA draft.
If you asked Orlando what he liked more, that Michael Jordan shoe or Zemi in the background, I don't know which one he'd be able to choose. Now, look, we keep reaching out to Sabrina, but, you know, she's really busy. She's winning awards and doing all kind of amazing things. But she did recently speak to the New York Times about the end of the season, it being canceled, what she's doing with her future, and with all the uncertainty that she's dealing with right now. She said, quote, "It's more like the fear of the unknown, not really knowing what's going to happen next. What does the future have in store? Is there going to be a WNBA season? Are they going to push it back? I don't have the answers to any of that. I don't have any answers at all." I think we can all relate to that, right? Basketball or not. But something tells me Sabrina's going to be just fine. Hey, and by the way, Sabrina, we're very proud of you, but keep an eye out for us in your inbox, okay? Now look, I got some questions to answer. I got some hashtag Hey Dan comments to read when we finish the story. That's coming up next.
So Natasha has a great question. She says, "Hey Dan, we keep hearing conflicting information on whether groceries are a potential source of contamination in homes and a source of COVID-19 spreading. Is there guidance from experts on how to best handle groceries brought into the home? Is there a need to disinfect everything as much as possible? Thank you, Natasha." So look, there's no evidence that anyone has gotten infected by this virus by eating contaminated food. However, doctors say all the packaging is a potential source of infection. So yes, you need to disinfect all packaging before taking groceries into your kitchen. Each package should be wiped down with a cloth that has been sprayed with cleanser or soapy water. Please keep sending in those questions using the hashtag HeyDan. We do our very best to answer them. And Jean wants to know, Hey Dan, is pink eye related to COVID-19? The answer here, it can be. So in a study published by Chinese doctors, they reported that some patients develop eye-related symptoms, including pink eye, and the virus has been detected in tears. So based on all that, eye protection is part of what doctors and nurses and other healthcare staff, what they're wearing in hospital settings. For us, it's important to remember to not touch our eyes unless we know our hands are 100% clean. So make sure you are washing those hands. Make sure you keep using the hashtag HeyDan and sending in these questions. We do our best to answer them every time.
All right, thanks, Kristen. Is she gone? Did she leave? All right, Kristen's my wife. I don't know if a lot of you know that. I was saying off the top of the show that, well, some would call me boring. I say I'm traditional. I usually just take her out to a nice dinner on an anniversary, get her a little gift. Well, our anniversary Sunday, and I can't really do either. So I was asking for advice, and a lot of people, they sent me a lot of good ones. Although this one, I don't know how it's going to play out. Dan, just be your charming self as your anniversary gift. I can tell you how that story would end. Anyway, this is how this one ends. So have a good weekend. We'll see you back here Monday.